Hello, my name is Ravi Vij. I'm from My Cancer Haven, and today in our Conversation with Cancer Expert series, we have a leading expert on chronic lymphocytic leukemia, Dr. Ryan Jacobs, who's at the Levine Cancer Institute and Associate Professor of Internal Medicine at Wake Forest University in North Carolina. We're honored to have him on the program today. Welcome, Ryan.
Yeah, thanks for having me.
So, Ryan, the first question I have is, what is double refractory chronic lymphocytic leukemia?
Right. So double refractory chronic lymphocytic leukemia is referring to a difficult to treat category of CLL patients that have been uh, uh, treated with in the past a covalent BTK inhibitor as well as BCL2 inhibitor venetoclax.
So, can you give us an idea about what the prognosis of this patient historically has been?
As these survival curves show, the prognosis has not been great, and this should, notably differentiate between the group of patients that might have been exposed to, say, BTK inhibitors, but not necessarily progressed on BTK inhibitors. The double refractory, is trying to zero in on these patients that have actually progressed and not just come off due to some other issue like toxicity. So progressed on a covalent BTK inhibitor like acalabrutinib, zanubrutinib, acalabrutinib, as well as having progressed on or shortly after treatment with venetoclax. Up until recently, we really didn't have any great FDA-approved treatment options, and understandably, in this patient population, the survival curves were concerning, just without having a real good treatment to go to for these patients.
So obviously we made tremendous progress in CLL, and it's one of the cancers in which we think conventional chemotherapy is history, but you're telling me that once you've been through a BTK inhibitor, the first and second generation of the drugs, and a BCL2 inhibitor, the prognosis has not been that rosy. Is that a fair